Welcome back as we continue our Conversations on the Couch series brought to you by Genesis Care. I'm Lindsay Morton, and today I'm joined by Dr. Scott Larson, a head and neck surgical oncologist, and today we're talking about head and neck cancer. Now, when we talk about after a patient's been diagnosed, are there treatment options for them? What kind of treatments would we recommend?
So there are treatment options. They vary considerably based on the patient. It's a very individualized decision, but things that help make that decision are, the location of the cancer, the stage of the cancer, the patient's age, and then their overall health status. So the typical treatment options that we discuss with the patient are surgery, and then there's radiation, and then there's chemotherapy. So depending on your particular situation, it can be one or even all of those treatments to treat your cancer. So, but as a general rule, if you're diagnosed with an early head and neck cancer, you'll usually just get one treatment, which will usually be surgery or radiation. If you're more late stage disease, you tend to get more treatments and sometimes even all three of those treatment options.
Are there any advancements to treatment that we could talk to patients about?
Yeah, so there have been advances over the last decade in treatment of head and neck cancer. We still have the typical three: surgery, radiation, and chemo, but all of them have made progress. As far as surgery goes, there's been a trend towards less invasive, minimally invasive techniques. And one good example of this is that in 2005, the Da Vinci robot was first used to minimally surgically remove a throat cancer. And since that time, that has advanced, and it's led to the use of the robot to minimally invasively treat throat cancers. Another, probably the most recent advancement in the treatment of head and neck cancer is immunotherapy. And that's when you take a medication to boost your immune system to help it fight the cancer. And this was initially used more for melanoma and lung cancer, but now we've seen in the last few years that it works for head and neck cancer, and that's really changed treatment for some patients.
Excellent. Awesome. Well, Dr. Larson, thank you so much for your time. Thank you all for joining us today. We'll see you next time as we continue our series of Conversations on the Couch.